we're going to go ahead and get started because we have a lot of information to cover today. Thank you again so much for the privilege of your time and joining us for today's Lunch and Learn session. We're going to go over some quick reminders and resources. We're going to talk about Pennie's No Wrong Door policy, the eligibility process, some troubleshooting with regard to medical assistance transfers, and then we'll have some time for question and feedback. Um, Hannah, if we could jump right in to some quick reminders. One of the things that we would like to sort of mention by way of a request from Pennie's policy office is to make sure that if you are a producer who speaks a second language or a language other than English, please make sure that that is highlighted on your Pennie profile as a producer. Pennies for all Pennsylvanians, regardless of their preferred language. Pennie understands that customers benefit uh, in discussing their health insurance options with someone who also speaks their primary language. And if you speak multiple languages, please make sure that those languages are highlighted on your profile. It could be anything from Spanish to Mandarin to Vietnamese to Russian, what have you. Um, and if you need assistance in making sure that those language options are highlighted properly on your profile so that people, when they're searching in our Find Local Assistance tool for a broker who has that particular language, that they can find you. You can reach out to 844-844-4440, and a broker service specialist can help you add that to your profile. Next slide, Hannah. Another thing that we'd like to bring to your attention is the fact that we are going to create a Pennie community work group. That community work group will meet on the second Friday of every month, beginning on April 8th, and it will replace the Outreach and Education work group, the broker work group, a broker lunch and learn, as well as the assister lunch and learn that we have. We are going to be operating this community work group by way of MS Teams Live, and the meeting will always be from 11 to 12 noon, and it's for all Pennie partners. So please keep your eyes open for the meeting invitation. Next slide. Some resource updates. We've had some really nice resource updates on the broker resource page. Under marketing collateral, you'll see right at the top where it says Path to Pennie Toolkit. This is a new program to help the uninsured in Pennsylvania connect not only with the right health insurance, but to connect with Pennie quickly. And we have tools available for our brokers where you can draw upon collateral that's already created. You can help promote by way of social media, email, what have you. But those tools are now available at the broker resource page. Next slide, please. And now I'd like to turn things over to my colleague Hannah Turner, who's going to provide us with a lot of really good information this morning. Thanks a lot for joining us, Hannah, and take it away.
Great, thank you, Scott. So for today's Lunch and Learn, we wanted to talk a bit more about some of the operational issues, questions, concerns that have been coming up from our broker and assister communities, and give you some more information about why certain things are happening and how you can troubleshoot those. But before we can talk about those scenarios, we want to start with just some level setting and get us a little bit in the weeds about how we actually operationalize a lot of the eligibility rules, and in particular, this no wrong door policy. So we'll go through that, and then we can talk a bit about some of these issues that folks are reporting in production, so you understand why things are happening and how to resolve them. So, a key part of the ACA was that no matter how someone comes to the marketplace, if they are seeking access to financial assistance to get health coverage, they're going to be potentially eligible for a number of different programs. But the purpose of the marketplace is to only require the customer to complete one application and then require the marketplace to determine their eligibility for a variety of different programs. So really great idea. Now operationalizing it becomes sometimes a little bit more complicated. For example, of the 4 different financial assistance programs that are available through the marketplace, some of them are administered by the Department of Human Services, so Medicaid, medical assistance, MA. We'll generally use the term Medicaid here in this presentation, as well as CHIP. So those are administered by Department of Human Services, whereas the APTC and CSR are administered by Pennie. However, we have to work together behind the scenes to make that a seamless, no wrong door experience for the customer. So no matter how someone comes to the marketplace, we're going to determine their eligibility for those programs. And there's a particular order that's required by federal law that we follow. So the first step is to determine their eligibility for Medicaid and or CHIP. If they are not eligible for Medicaid or CHIP, only then can you move down to the second step, which is checking their eligibility for marketplace coverage, or QHP coverage with APTC and or CSR. And then if they're not eligible for that, then just simply marketplace coverage, full premium marketplace coverage. But it has to happen in that order. And of course, remember, eligibility is based on individual members of a family. There's lots of complicated mixed eligibility scenarios where a family might have some people eligible for Medicaid or CHIP and other people in the family eligible for APT CSR. Just a reminder that those exist. What we're going to talk about today, we're not going to talk about the eligibility rules for each of these programs. You all know those well. If you need a refresher, you should go back to the training materials. We're going to talk about how we go about this process. So what does Pennie do when we get an application for a financial assistance program? So the first step is we determine, are they going to be eligible for Medicaid or CHIP, right? That's what the federal law says we have to check first. Depending upon those results, they might be potentially eligible or not eligible. You'll see we use the term potentially eligible because it's critical that we can assess the likelihood that someone is eligible for Medicaid or CHIP, but only the Department of Human Services can actually make that final eligibility determination. So when we determine someone potentially eligible, then we send the application to DHS, who actually reviews it, maybe goes through a caseworker, and makes the final eligibility determination. And then if DHS says that person is eligible for Medicaid or CHIP, then the customer will be enrolled in Medicaid or CHIP. Eligibility is done. They're done with that process. Now, what happens if the DHS comes back and says, Pennie, no, I know you thought this customer was potentially eligible, but we've reviewed and they are actually not eligible for Medicaid or CHIP. So what happens at that point is Pennie then says, okay, we now have some additional information. We're going to go ahead and resubmit the customer's original application and add this additional piece of information that DHS has denied the customer's eligibility for Medicaid or CHIP. And why is that denial important? It's important because we have a second step here that allows us to, when this application comes through, we see that the customer, we look to see, are they eligible for Medicaid or CHIP? Or were they recently denied for Medicaid or CHIP? That's our other way of sort of skipping that first step and being able to move down to the second step of eligibility. So for this customer that was DHS determined they were not eligible, they go back through the beginning of the process, and because they were recently denied, we're able to move forward and determine their eligibility for marketplace coverage with APTC and or CSR. And then things are a little bit easier from here. If they are found eligible, great, they can enroll in a QHP with whichever APTC and or CSR they are eligible for. If they're not eligible for APT CSR, then we're going to go ahead and see, are they eligible to enroll through the marketplace, but with no financial assistance? And then we would enroll them in QHP. So what we're going to focus on a lot is actually this first step, since there's a little bit of complicated handing over of applications and different parties doing all this work behind the scenes. So let's take a few examples just to talk through and illustrate how that process works. So for this, I'm going to use really simple examples here. So we got two adults. You stick to U.S. citizenship. We're not going to talk about the rules behind Medicaid eligibility. But basic income rules, we've got someone with 100% of FPL, and they submit their application to Pennie. Because of that 100% of FPL, we determine that they're potentially eligible for Medicaid. It would be, you could use Medicaid or CHIP interchangeably in this example. The process is really the same from this perspective, just different things happen behind the scenes between Medicaid and CHIP. So we send that application to DHS. Sometimes you'll hear us call that an account transfer. Try not to use none of those technical terms with the customers, but just so you have some of the terminology that you may hear. In this example, DHS reviews the application and says, yep, they're eligible for Medicaid. Great. They then notify us back saying this account transfer you sent to us we found them eligible for Medicaid. Pennie closes the application and simple customer is eligible for Medicaid. That's a pretty straightforward process there. Let's take scenario 2, and we'll actually use the same facts. So we've got two adults with 100% of FPL. They apply to Pennie. Based on that income, we assess that they're potentially eligible for Medicaid and send their application to DHS. However, jumped ahead. In this scenario, DHS comes back and says, no, they're not actually eligible for Medicaid. And remember, there's a whole lot of reasons why, things like different ways that household income is calculated. So it is possible to have seemingly similar cases, but with different results of their Medicaid eligibility. So now we've got a denial from Medicaid. So again, Medicaid notifies us of that denial. They respond to our account transfer. That then triggers that flow that we just talked about, where Pennie then resubmits that application, adds the new information, this Medicaid denial date, which lets us then determine their eligibility for APT CSR. Simple scenario, this customer will be eligible for APTC and CSR. And of course, reminder that you still would have to have to enroll in a QHP, they still have to have a life event when it's outside of open enrollment, like it is now. In this scenario, because the customers have 100% of FPL, when Pennie resubmits their application, determines their eligibility, we would actually automatically be granting an SCP for these folks because they have less than 150% of FPL. So that's that new SCP. We talked about this in last month's Lunch and Learn. Okay, so next scenario, we've got two adults. Now they've got a little bit higher income of 200% of FPL. These folks, though, no wrong door, they start their application with Medicaid through Compass. In this scenario, DHS determines they're not eligible for Medicaid. Their income here is going to be too high. So they send the application to Pennie and with the customer's application information and the fact that they've just denied them their Medicaid eligibility. We'll sometimes call that referral versus an account transfer, if you hear that terminology. So what we do with that is similar to what we do in the previous example, but this customer's never been to Pennie before. So we're going to go ahead and create an account, load their application with that Medicaid denial date. What's slightly different is right now the customer actually logs into Pennie and has to review and submit their application. We do have an enhancement coming up shortly where they're going to be able to skip this step where Pennie is going to be able to actually submit the application for them. But right now, what you're used to is the customer actually goes in and hits the reviews and hits the submit button. That lets Pennie determine their eligibility. Because of that Medicaid denial, we already know that we can skip that first step, come to step 2, and we'll find they're eligible for APTC and CSR with that 200% of FPL. And again, to enroll in a QHP, they'd have to have a life event. Calling it out because in this case, the customer has more than 150% of FPL. So this customer actually have to report a life event to then enroll versus the previous scenario where we would automatically grant them that low income SCP and they would just have to come in and enroll. Okay, so Let's talk about some of the troubleshooting of some of the potential issues. We went and kind of reviewed a lot of the scenarios that have been raised to us again by brokers and assisters recently, and wanted to kind of walk through those, explain why it's happening, and what you can do about it. The first issue is a common one. So how do you proceed while you're waiting for a DHS eligibility determination? So this is where the customer submits an application through Pennie, found potentially eligible for Medicaid or CHIP, and now we're in that waiting period. As we talked about in those original process flows, Pennie cannot move to the second step of checking their eligibility for APTC or CSR until DHS finishes that determination of eligibility for Medicaid or CHIP. And depending upon the case, that processing from DHS can vary significantly. We see applications coming back to us within a day. Those are ones that they're able to kind of automatically review and approve. Or some of them may take 30 days or even more. It just depends. Most of the eligibility determinations we get back from DHS, we do receive within about 2 weeks. And while we're in that, let's just standard kind of 2-week-ish processing time, Pennie CSRs can't really give any updates because that application is with the DHS caseworkers for review. So what can you do during this time? Unfortunately, not a lot. Really, to kind of be patient while DHS works through, caseworkers work through the application and to finalize that eligibility. You can help by studying appropriate expectations with the customers about, the variability of that processing time, kind of what a normal eligibility determination period is. And you're going to want to avoid submitting additional applications through Pennie while you're waiting for that DHS determination. So hold that thought because we're going to come back to that in a future item. Okay. Issue number 2 that we see a lot. So we have customers who are currently enrolled in a QHP through Pennie and then become now Medicaid enrolled. And we have, but are retroactively enrolled in Medicaid. So the Medicaid enrollment has a retroactive start date. When a customer is currently enrolled in a QHP and then is enrolled in Medicaid, we will trigger a termination of their QHP. However, the QHP rules say that we can only terminate that prospectively. So we'll terminate their QHP coverage at the end of the current month, even though their Medicaid enrollment may be retroactive. So that can sometimes result in an unintended duplicate coverage between Medicaid and their QHP. So what can you do here? Contact Pennie customer service to request that retroactive QHP termination. All we need is a copy of the Medicaid enrollment notice because that's going to include the key information of which members are enrolled in Medicaid, their coverage start date, and the date of that notice. The date of the notice is important because it still has to be reported to us timely. So you can't come to us 6 months later and try to get a retroactive termination, right? But if you give that information to the Pennie customer service team, they will be able to process that retroactive QHP termination to avoid that unintended duplicate coverage. Okay, so issue number 3. In this scenario, you have customers who are enrolled in Medicaid pending an appeal, but Pennie still shows the customer as Medicaid denied. So the way this happens is that a customer is denied Medicaid. Medicaid tells Pennie, and so Pennie proceeds with their eligibility as if they were denied Medicaid. When the customer receives their Medicaid denial notice, there is a time period where they can submit an appeal to Medicaid. If they do that timely, then Medicaid will actually enroll them pending their appeal. The problem is that appeal submission to Medicaid that triggers them to be enrolled in Medicaid pending appeal, that information doesn't currently get sent to Pennie. So this is where you end up with this discrepancy of the customer looking on the Pennie side as if they were denied Medicaid, but they're now enrolled in Medicaid because of that appeal process. We're working with DHS to try to improve this process and develop some, make it work a little bit better. But for now, what you should do is if you are working with a customer and you know that they have appealed their Medicaid, simply contact Pennie customer service. We just need to know that. And if you have a scenario where there's going to be retroactive QHP termination needed, because if that Medicaid enrollment is retroactive, you'd follow the same steps as before, just submit a copy of the Medicaid enrollment notice that they received, and Pennie customer service will be able to help make sure that they're not, don't have overlapping coverage. Okay. Issue number 4. So we have, say we have a customer who's denied Medicaid because their income is too high, but then they are found not eligible for APTC. So we've been seeing a little bit more of these scenarios coming up recently. And there's a new issue that's happening we'll talk about, but there's a couple of things that could be happening. The new issue that we're seeing is these are customers who start with Pennie application. It's found potentially eligible for Medicaid. We send the application to Medicaid for determination, and Medicaid comes back with that denial. If you remember our process flow, when Medicaid comes back with that denial, we resubmit the application with the denial information. The problem that's happening here is that the denial that's coming back to us from Medicaid is sometimes is missing certain pieces of household income. And the pattern is it's usually a certain type of income that's being impacted, like we're seeing it with Social Security income, and I think self-employment income. None of the job-based stuff is an issue, and this is why you're not seeing it broadly, but you may have a few of these come up. So, like I said, it's a relatively new issue. We're working with DHS to resolve that. But the problem is that now we resubmitted that application, but we don't have the complete household income because some of that income was missing from the denial that we got back from Medicaid. So, what then is happening is when that application is resubmitted with some of the household income missing, we're seeing customers then falling below 100% of FPL. And therefore, they're not eligible for APTC or CSR. So it's this what sounds like a scenario that shouldn't really occur, where someone has too much income for Medicaid, but their income is too low for APTC. So there are scenarios where people can get APTC under 100% of FPL, but that requires some immigration statuses that make them ineligible for Medicaid. So, we're looking at if someone's a U.S. citizen and has income under 100% of FPL, they will not be eligible for APTC. So what you should do is, if you think that this has happened, if you see a customer who's denied Medicaid and for some reason you aren't seeing that they're not eligible for APTC after this, first thing I would do is go look at the recent application and see if their income looks like it's missing something. If that's the case, it's actually a really simple fix to just resubmit the application with the updated income, and immediately we will reprocess that APTC eligibility based on their full household income, and everything will be applied automatically. If you go back and you look and you see like all the income is there, but for some reason they're still not eligible for APTC, don't forget to look at their tax filing status. This is one that I often forget to double check. If someone is listed as married filing separately, even if their income is within the, a traditional APTC eligibility range, married filing separately will make you ineligible for APTC. So look for the income issue, and that is an issue that we're actually working with DHS to resolve. But don't forget about the potential of that married filing separately being another reason why someone looks like their income should make them eligible for APTC, but they're being found not eligible. Okay. Apologies for going kind of fast through these, but we wanted to make sure we could hit some of them. We will have the recording available and the deck afterwards here. The next one is sort of similar here, but we usually hear the question of why did Pennie change? Why did the Pennie eligibility change when I did not submit an application? Right. So what has most likely happened here is the customer submitted an application and we sent it to DHS for determination. And then DHS, like we said, can take sometimes a little bit of time before they respond back. But when we do get that response back with a denial or an enrollment, whichever one, we will update their eligibility in the system automatically when we receive that from response from Medicaid. So every time we send an application to DHS, we will get a response back from them as either eligible or ineligible, but it may take some time. And so when you think you're saying, okay, they didn't submit any application, it's probably this is a response from a earlier application that's just now coming back from DHS. So when that happens, though, depending upon the amount of time, which, as we know, can vary, you can see some really strange results depending on what happens during that period of time. So if we follow my little example here, this customer on the 25th of March submits application 1, and their income that they supplied is 130% of FPL. That means we found them potentially Medicaid eligible, send them to DHS. And now we're waiting for DHS to do their determination. The next day, March 26th, they submit another application number 2, to Pennie with updated income. Now they're at 160% of FPL. So Pennie then moves forward and says, okay, based on that, they're going to be eligible for APTC and CSR. They report a life event and they enroll in coverage for 4-1. Great. But we still have application 1 that's out there with DHS, and DHS has to proceed with their eligibility determination. This timeline we have on April 2nd, DHS finishes their eligibility determination and says that they are denied eligibility for Medicaid and send that response to us. Remember, that response triggers us to resubmit that application. It's called application number 3, which has the same information that was on that original application with their Medicaid denial date. In this scenario, that's actually putting their income back to the original 130% of FPL, even though they've submitted new applications since. Now that there's different income, it's going to result in different eligibility. Eligibility is automatically updated on their current enrollment. And that's where you would see this eligibility change happening for kind of when you didn't submit an application, but it's really because it's a response to a previous application. So you have to watch out for that overwriting scenario. And that's why in the earlier, I think it was issue number 1, we said you should avoid submitting multiple applications while you're waiting for an update from DHS. And that's because this scenario can happen. And we see this happening, causing some frustration for folks. So ideally, you should avoid submitting multiple applications during that process. But if you see this happen, if you see something where their eligibility changes and they didn't submit any application, you should immediately think, okay, I need to look to see, did we get a response from a Medicaid denial? And then if that did happen, simply just update their application, in this case, to update their income back to the 160% of FPL, and everything will be updated again with their correct eligibility going forward. If you have questions on this, actually, it's usually pretty straightforward to see when you look in their application history or their notices, but you can call Pennie Customer Service and they can also help you kind of walk through the applications to see what happened there. And then lastly, our last item here is actually sort of similar here, but instead of saying, why did the eligibility change when I didn't submit an application, we sometimes hear, why did Pennie's enrollment change when I did not submit a plan change? So when someone gets a Medicaid denial back, we reprocess eligibility, we might get a change in their eligibility for cost sharing reductions. This can actually also happen if someone simply just updates their income on Pennie, and that might move them from CSR eligibility to a different type of CSR eligibility or no CSR eligibility. But whenever that CSR eligibility changes, if the customer is currently enrolled in a silver plan, Pennie automatically changes the enrollment to put them in the appropriate CSR version of that plan. So maybe the customer goes from being not CSR eligible to being eligible for CSR 6. Well, we're going to automatically switch them to the CSR 6 version of the plan. Where this can be kind of confusing is that CSR versions of the same plan often have different plan names. So it might not look like the exact same plan, but it is. That's because it's the same core plan with this different cost sharing reduction version of the plan. So because that different plan name thing, it can be a little bit tricky to look at the application and see that that's what happened. So if you have this scenario happen where you think that there was a plan change that you weren't expecting or don't think the customer submitted, what I would recommend doing is you go back and look at their recent applications to see if their CSR eligibility changed. And then if their CSR eligibility changed, and double check that they're enrolled in a silver plan, almost guarantee that this is what's happened. Their CSR eligibility changed. They were just moved from one version of their silver plan to a different version of the same silver plan. If the customer was enrolled in a plan other than silver, maybe bronze, gold, um, we won't automatically change their enrollment when their CSR version changes because they're not in a silver plan. They would have to actually, be able to shop for a silver plan. And if you need help verifying this too, Pennie Customer Service can do that. They're able to see some of kind of the back end internal ID numbers for the plans that can help really confirm that, yes, these two different plans that have different plan names are actually the same silver plan with just different CSR variations. And 2 minutes over, but do want to remind you guys that if you have any questions, please always reach out to customer service 844-844-4440 for the dedicated assister and broker teams. And if you have any questions, you can also reach out to brokers@pennie.com. And we appreciate your feedback, Scott. I think this will all get posted afterwards at some point.
Absolutely. And in fact, as soon as the recording is ready, we'll have it up on our broker resource page and on YouTube. So well, thank you again, everyone, for your time this afternoon. And we hope you have a peaceful week.